Welcome to the deep dive. Today we are exploring a really critical topic, emergency burn care. It's something where knowing the right steps is vital because honestly, getting it wrong can make things so much worse. Most of us probably have some idea, right? Maybe something our grandma told us about butter or, maybe a warning about using ice. But that kind of folklore or mixing up what to do for a small kitchen burn versus, say, a serious chemical spill, that can lead to real trouble. So, our mission today is to clear away that confusion. We've looked at the protocols, the science, and we're going to synthesize the immediate first aid you actually need to know. We'll compare the 3 degrees of burns, first, second, and third, and really nail down the rules, especially for tricky situations like chemical or electrical burns.
Burns can be caused by contact with extreme heat, chemicals, radiation, or electricity. Burned areas can appear red, brown, black, or white. You may see swelling, blisters, or both. To care for any type of burn, remember 3 simple steps: stop, cool, cover. After sizing up the scene, stop the burning by eliminating the cause of the burn if it is safe to do so. Next, cool the burn using cool or cold clean running water for at least 10 minutes. Finally, cover the burn loosely with a dry, sterile dressing. Burns involving blistering or broken skin should be evaluated by a healthcare provider. Some burns are minor and require only first aid care, but others are critical and require a call to 911 or the designated emergency number. To decide whether a burn is critical, look at the following factors. What caused the burn? Burns caused by electricity, chemicals, nuclear radiation, or an explosion are considered critical burns. How deep is the burn? Burns can affect only the top layer of the skin, or they can extend through the deeper layers of the skin or the fat, muscle, or bone underneath. The deeper the burn, the greater the severity. How much of the person's body is burned? A burn that covers more than one part of the body or covers a large percentage of the person's total body area is considered a critical burn. Where is the burn located? Burns in areas where they could impair function or the person's ability to breathe, such as the head, neck, hands, feet, or groin, are considered critical burns. How old is the person? If the person is younger than 5 years or older than 60 years, consider the burn critical unless it is very minor. If you think that a person has a critical burn, call 911 or the designated emergency number immediately.
Yeah, distinguishing the cause is fundamental right from the start. It's not always about fire or hot surfaces. Our sources group the causes into, 4 main types. You've got direct heat, obviously. But then there's chemical exposure, radiation, think severe sunburns here, and electricity. Knowing which one you're dealing with really shapes that first crucial minute of response.
Okay, let's start unpacking that with severity. When people talk about first, second, or third-degree burns, it all comes down to one thing, right? How deep the damage actually goes into the skin.
Exactly. It's all about the layers. Think of your skin having 2 main parts. There's the epidermis, that's the thin, tough outer layer, kind of like the body's shield.
Okay.
And underneath that is the dermis. That's where you find blood vessels, nerves, hair follicles, all the operational stuff.
Gotcha.
So a first-degree burn is superficial. It only damages that top layer, the epidermis. It's basically just surface irritation.
Right, like a bad sunburn maybe? Though you said that's radiation.
Similar effect on the surface, yeah. Red, painful, but technically different causes. With first-degree thermal burns, think touching a hot pan briefly.
Okay, so if first degree is just the outer shield, what defines a second-degree burn?
That's when the damage gets to the epidermis and into the dermis below. It's breached the main barrier. This is where it gets significantly more painful and complex because you're hitting nerves and blood vessels.
And then the most severe, third degree.
Yeah, third degree is catastrophic damage. It goes through both skin layers, epidermis and dermis, and down into the subcutaneous fat beneath. It can even reach muscle, bone, and destroy nerves completely.
That framework makes sense. But in an actual emergency, what does someone see? What are the immediate visual clues that help you tell these apart?
Okay, for a first-degree burn, you're looking at reddened skin. It'll likely be a bit swollen and definitely painful to touch. If you press on it, it might turn white for a second, then go back to red. Looks hot and angry, but the skin itself isn't broken.
Right. Then for second degree, you mentioned blistering before. That seems like a key sign.
It is. Blistering is classic for second-degree burns. That happens because fluid collects under the damaged epidermis to try and cushion the injured dermis.
Ah, okay.
The skin itself often looks kind of patchy, maybe mottled red and white, and it can look quite wet or weepy because plasma is leaking from damaged capillaries. Plus, you'll see more significant swelling and usually intense pain.
Okay, that's clear. Then third degree. The descriptions sound pretty stark. White, maybe brown, or even charred black, leathery texture.
Exactly. The tissue is essentially destroyed. But here's the really crucial and kind of counterintuitive part you need to watch for: the pain level.
What do you mean? Isn't it going to be incredibly painful?
It can be, or
Yeah.
it can be relatively painless, and that lack of pain is a huge red flag.
Wait, painless is worse?
Much worse.
Yeah.
If the burn looks terrible, white, charred, leathery, but the person isn't reporting extreme pain in that specific area, it means the nerve endings in the dermis have been destroyed by the heat. That signals a very deep, full-thickness injury. It's a critical emergency.
Wow, okay. So lack of pain can actually mean more severe damage. That's vital to know.
Absolutely vital.
All right, so we can hopefully identify the severity. For a typical thermal burn, heat, fire, hot liquids, the sources give us a simple sequence. Stop. Cool. Cover. Can you walk us through that?
Sure. First step is stop. Get the person away from the heat source immediately. If clothes are on fire, stop, drop, and roll, or smother the flames. Just stop the burning process.
Makes sense.
Second is cool. And this is where people often go wrong because they don't do it for long enough. You need to run cool or cold potable water, like clean tap water, over the burn for at least 10 minutes. Some sources even say up to 20.
10 minutes minimum. That sounds like a really long time when someone's hurt. Why so long?
Because the heat doesn't just vanish the moment you remove the source. It continues to penetrate deeper, cooking the underlying tissue. That extended cooling is essential to actually draw the heat out and stop the burn from getting worse, from damaging deeper layers. You're actively halting the injury progression.
Okay, that makes sense. Stop the cooking process. And the third step, cover.
Right. After cooling, you loosely cover the burn with something sterile, like a gauze pad, or even just a clean cloth, if that's all you have. The key is loose. You're protecting it from infection and air, which can increase pain, but you don't want anything tight or fluffy that might stick.
Okay, stop. Cool. Cover. Got it. Now let's drill down into the specifics for first and second degree, especially for smaller burns that might not need immediate ER treatment. For a simple first-degree burn, after we've done the cooling for, say, 10-20 minutes, what's next?
After cooling, you can put on something soothing like aloe vera gel. Helps with the sting and keeps them moisturized. An over-the-counter pain reliever like ibuprofen or acetaminophen can help manage the discomfort. Since it's just the top layer, these usually heal up pretty quickly, maybe 5 or 6 days.
Simple enough. But second-degree burns, they're trickier because of the blisters. We've cooled it for 20 minutes, but now we have these fluid-filled bubbles. What's the rule here?
Yes, and this is probably the most important takeaway for second-degree care at home. Do not pop the blisters, especially not within the first 72 hours.
Why not? Isn't it better to drain them?
No, definitely not initially. That blister is nature's sterile bandage. The fluid inside is protecting the raw dermis underneath. If you break that blister bubble open too soon, you're basically opening the door wide for bacteria and increasing the risk of infection, which also slows down healing.
Ah, okay. So leave the blister intact. What do you do instead?
You should gently clean the skin around the blister with mild soap and water, pat it dry very carefully, then apply a sterile, non-stick dressing loosely over the area to protect the blister. Healing takes longer because the dermis is involved usually around 3 to 4 winks, and you need to keep an eye on it for signs of infection.
Right. So protect the blister, keep it clean, cover it loosely. Got it. Now, let's shift gears to the real danger zone. Third-degree burns and situations where any burn becomes critical. We know third degree is deep and destructive. Why is it considered immediately life-threatening?
Well, the danger goes way beyond just the local tissue damage. The sources point to 3 huge, immediate systemic risks. First, massive fluid loss. Second, an extremely high risk of infection. And third, consequently, shock.
Can you elaborate on the fluid loss? How bad can it be?
Think of your skin as your body's waterproof container, right? It regulates hydration, temperature, everything. When a large area of that container is just gone, like with a third-degree burn, your body starts losing essential fluids, plasma, water, electrolytes incredibly fast.
Like a leak.
Exactly. A massive uncontrolled leak. This leads rapidly to dehydration and electrolyte imbalance, which can quickly cause hypovolemic shock. That means the circulatory system starts to collapse because there isn't enough fluid volume to maintain blood pressure. It's why immediate IV fluids in a hospital setting are absolutely critical for survival.
So for third degree, first aid is really about calling for help immediately, managing pain if possible, and trying to keep the person stable until paramedics arrive. Long term involves hospitals, maybe skin grafts.
Precisely. It's advanced medical care, not home treatment. But, and this is important, it's not just third-degree burns that automatically require seeing a doctor or going to the ER. There's a set of factors that make any burn potentially critical, even a second-degree one.
Okay, what are those critical factors we need to look out for?
The sources generally list about 6 key things. First, obviously the depth of the burn. Third degree is always critical. Deep. Second degree often is too.
Right.
Second, the percentage of the body surface area that's burned. Even a superficial burn can be life-threatening if it covers a very large part of the body. Think rule of nines, or just generally, is it bigger than the person's palm? Significantly bigger.
Okay, size matters. What else?
Third is location. Burns on the face, hands, feet, over major joints, or on the genitals are always considered critical, regardless of depth or size. This is because of the risk of functional impairment, severe scarring, and, for the face, potential airway involvement.
Makes sense. Functional areas.
Fourth, the age of the person. Burns are much more dangerous for young children and older adults. Their skin is thinner, and their bodies just don't cope as well with the fluid loss and infection risk.
Okay, age is a factor. 2 more.
Fifth is the cause of the burn. As we'll discuss, chemical and electrical burns have unique dangers that automatically make them critical. And finally, number 6, the often overlooked but deadly serious risk. Inhalation injury.
You mean breathing and smoke?
Exactly. If the person was burned in a fire, especially in an enclosed space, they might have inhaled hot gases or toxic fumes. This can cause swelling in the airway or damage the lungs. Any suspicion of inhalation injury is an immediate, life-threatening emergency requiring airway management.
That's a comprehensive list. Definitely highlights that assessing a burn goes beyond just looking at the skin.
I've always loved running, and I think I really just loved the sense of adventure I got when I would go for a run. And that's part of the reason why I was drawn to trail running or ultra marathons. On the 2nd of September 2011, I was running in an ultra marathon, which is usually around 100 kilometers. So I was a quarter of the way through the ultra marathon and I became trapped by a grass fire. I remember just being faced with a wall of flames, and the thoughts that were going through my head was how unfair it was that I was never going to see Michael again, and that we wouldn't be able to create our future together, and that we would never have kids. We waited for hours for help to arrive, and help arrived in the form of the local paramedics from town. And I recognised one of the paramedics because I used to volunteer with her on my weekends off from work. So I said, "Hey Bonnie, how are ya?" Now she just gave me a blank look. She didn't even recognise me. And so I said, "It's me, it's Taria." She didn't say anything back, but I noticed a tear start to roll slowly down her face. And, although part of me thought I was fine, I'd be back at work on the Monday, seeing her tears made me think maybe this is way more serious than I could have ever anticipated. I was medevaced to hospital. I walked off the helicopter into the hospital. I was begging the doctors and nurses, "Can someone please call Michael?" I woke up around a month later in a hospital in Sydney.
So when Terea was in hospital, I got a call at about 12 o'clock in the middle of the morning from a doctor at the hospital who told me all about the accident, what had happened to Terea. And I was quite shocked, and my initial thoughts were, how bad was the accident? How bad is she? And they sort of said, like, it's life-threatening.
When you're burned, what they do is they'll remove your burnt and damaged skin, but then they need something to cover you with. Now, real skin is the best stuff to use because it's got infection-fighting properties. But when I was injured, there was no skin in Australia at the time. And so my surgeons frantically searched the world to find some skin, and thankfully for me, they found some skin in America through the MTF. Now that skin got packaged, got sent to Australia, but then came my surgeon's next problem. Customs in Australia would not let this life-saving package of skin through.
And so the surgeon called the customs up and he said, look, if you don't allow this skin to come through, she'll die, and she'll die like this afternoon. I've done everything I can to preserve her life, So that was a pretty full-on moment, and so the customs heard that and they actually cleared the skin, which was illegal at the time.
Thankfully for me, they got the skin, they covered me with it, and within a couple of days, I made a dramatic improvement. My vital signs all turned around, and my doctors managed to put me in a relatively stable position. Without that skin that was donated, I would not be here today. That skin literally saved my life, and it was due to the generosity and the grace of 16 Americans that I'm here today. It's very easy for us to get caught up in the narrative of our life, and it's very easy for people to start using excuses. So, this happened, so I can't do this, or I'm too busy, so I can't do that, and I don't have a supportive partner, and this happened to me. And yeah, bad stuff does happen to good people every single day, but that's not what defines you. What defines you is how you respond to those challenges, how you cope with those challenges. I'm incredibly passionate about tissue donation. The impact that that donor has is extraordinary. One tissue donor can help to heal and transform the lives of up to 100 different people. So that's a pretty extraordinary legacy that that donor leaves, and I think that's a really beautiful thing for someone to do.
When Taria was in the coma, I was very uncomfortable, but she was the girl that I fell in love with, and she was still going to be the same girl I fell in love with. And so it was at that time when she was in the coma that I bought her a diamond ring. Without that skin, she wouldn't be here. So I always think about that, and it'll be in our lives forever, that some unknown people in America have beautifully given their skin, and it saved her life, which has given me back my girlfriend, and we now have a future together. Hopefully we're going to have kids and get married, and Taria's fit and healthy, and she's inspiring people all over Australia and the world, and life's good again.
Okay, let's talk about these special causes you mentioned. Chemical and electrical burns. They need different steps, right?
Completely different initial steps, yes. For chemical burns, you first need to know if it's a liquid or a dry powder. If it's a liquid chemical, the immediate action is flushing. Copious amounts of cool, running water over the area for a full 20 minutes. While flushing, carefully remove any contaminated clothing. Dilution and removal is key.
Okay, flush liquids for 20 minutes. But you said dry powders are different. Why can't we just wash them off?
Because some dry chemical powders react with water. They can generate heat, basically causing a new thermal burn, or they can form a more corrosive liquid right there on the skin. Think about things like lye or dry cement powder.
Ouch. Okay, so what do you do with dry powders?
The absolute rule is put on protective gloves first, then carefully brush off as much of the powder as you possibly can. Get the bulk of it off the skin before introducing water. Once the powder is brushed away, then you flush the area with cool running water, usually for about 15 minutes. And with any chemical burn, liquid or powder, seek medical attention immediately afterwards.
Right. Brush, then flush for powders. What if the chemical gets in the eyes?
Immediate, continuous flushing with clean water for at least 15 minutes. Tilt the head so the water runs away from the unaffected eye. This is crucial to minimize damage to the cornea. Get medical help right away.
Got it. Okay, now, electrical burns. These sound particularly dangerous, not just for the victim, but maybe for the rescuer, too.
Absolutely. The number one non-negotiable rule before you even approach someone who suffered an electrical shock is make sure the power source is turned off. If you can't turn it off at the breaker or unplug the appliance, do not touch the person. You could become a victim yourself. Scene safety first, always.
Okay, power off first. Then what? What's unique about electrical burns?
Well, the really tricky thing is that the visible injury on the skin, the entry and exit points might look quite small, almost insignificant sometimes. But the electricity travels through the body, and it can cause massive internal damage along its path. Tissues, muscles, nerves, organs.
So the surface burn isn't the main story?
Often, no. The internal damage is the big worry. And critically, because electricity disrupts the body's own electrical signals, it can cause immediate cardiac arrest or stop breathing.
So even if the person seems okay initially?
Yes. You have to assume there might be internal injuries. Check for breathing and pulse immediately after ensuring the power is off. Be prepared to start CPR right away. Electrical burns are always a medical emergency because of that hidden, potentially fatal internal risk and the risk to the heart rhythm.
Okay, that's sobering. Seems like calling emergency services is paramount for both chemical and electrical. Let's wrap up by tackling some common myths. Quick fact or fiction round.
Let's do it.
Okay, fact or fiction. Slathering butter, oil, or greasy ointments on a burn helps soothe it.
Big fiction. Terrible idea. Grease traps the heat in, prevents cooling, and basically makes the burn deeper. Plus, it's a breeding ground for bacteria. Stick to cool water.
Good to know. Fact or fiction? A really bad sunburn is basically just a mild thermal burn.
That's fiction too. While it feels hot, sunburn is caused by UV radiation, not direct heat. It's a radiation burn, and the mechanism of damage and treatment is different. You focus more on hydration and reducing inflammation.
Okay. Fact or fiction? Put ice directly on a burn to cool it down fast.
Oh, definitely fiction.
Yep.
Never use ice. It's too cold and can cause further tissue damage, almost like frostbite, to skin that's already injured. Cool or cold, running water is the way to go, not ice.
Right, water, not ice. Fact or fiction? You should monitor for shock even if a burn seems relatively minor.
That is absolutely fact and the tea. Any significant burn, regardless of degree, can trigger a systemic stress response in the body. Pain, fluid shifts, fear. It can all contribute to shock. So yes, always monitor the person's overall condition, breathing, alertness, skin color, not just the burn site itself.
Okay, this has been incredibly clarifying. It really boils down to specifics, doesn't it? Knowing the difference between first, second, and third degree. Remembering that core sequence for thermal burn, stop, cool, cover, and knowing when the rules change, like brushing before flushing for dry chemicals.
Exactly. And if we pull back to the bigger picture, what the sources really underscore is that even when a burn injury looks localized to the skin, the body often reacts systemically. We naturally focus on the visible wound, but there's this potential for hidden dangers like shock or internal damage, especially with certain types of burns. Which leads to a really important question for you, the listener, to think about. Since we know burns of all types can potentially cause shock, how vital is it really to pay attention to the injured person's overall state? Things like their pulse, their breathing, how alert they seem even if the burn itself doesn't look enormous or incredibly deep on the surface. What signs beyond the skin injury should you actually be looking for?
Knowing the protocols is step one, but recognizing those deeper risks. That seems like the key to being truly prepared. Thanks for diving deep with us today.